Melatonin is quickly becoming one of the more popular ways for seniors to get better sleep. But there is a right way and a wrong way to take it. And if you're not careful, you could actually end up doing more harm than good. So in this video, we will walk through the careful considerations you should know about melatonin to get a good night's rest. Hey everyone, I'm Dr. Michael Breus, the sleep doctor. You might be curious, what exactly is melatonin? Melatonin is a naturally occurring hormone that's produced in our pineal gland. It is part of our natural sleep-wake cycle as it regulates our circadian rhythm. During the day, remember that light hits your eyes and suppresses the production of melatonin, which tells your brain that it's time to get ready for the day. But at night, as the amount of natural light lowers, that lack of light tells your body to start producing melatonin again, which is why it is a key player for your sleep. In a way, melatonin could be described as the key that starts the engine for sleep. Melatonin tells your brain when it's bedtime, which can be very beneficial if you struggle to fall asleep. But it won't stop you from waking up in the middle of the night or the early morning. Now, some people will try taking melatonin if they wake up in the middle of the night and can't get back to sleep. But this is a terrible idea because it will change your circadian rhythm and it'll make you feel really groggy the next day. So it's best to only take it at the beginning of the night. Most younger adults produce an adequate amount of melatonin, so it's not vital for those who are younger to take it unless you have a deficiency. However, as we age, we naturally start to produce less melatonin, making it harder to fall asleep as we get older. So the big question is it okay for seniors to take melatonin? Yes, but with some caveats to take into consideration. Caveat number 1, when taking melatonin, it's important to pay attention to your dosage. I recommend that seniors take between 0.5 and 1 milligram of melatonin as a supplement. And if you find yourself not getting much benefit from this amount, you can slowly increase your amount up to about 1.5 milligrams. Now, I know what you're thinking, Dr. Breus, that's too low. It is very common for over-the-counter supplements to have too much melatonin in them. You may see some of the over-the-counter dosages ranging from 3 milligrams to 5 to even 10. I've even seen as high as 60 milligrams. And frankly, that is significantly beyond what you would ever need in a dose. So before taking melatonin as a sleep aid, double check your dosage on the bottle. And while overdosing on melatonin is rare, it's important to be mindful of side effects since these can be a factor in too high of a dosage. Some of the symptoms you can expect as side effects if you've got too much melatonin on board are nightmares, headaches, irritability, stomach pain, and nausea. Caveat number 2, there are a lot of junk brands out there for melatonin. Unfortunately, melatonin is not regulated by the FDA, and this can result in wildly differing amounts in your supplements. Some brands have too little, some may have way too much, as I mentioned before. Some researchers have even found that these junk brands can include other substances like serotonin, which can be counterproductive to using melatonin in the first place. So what are some good options to look for? Consider looking for brands that have the USP or the NSF verifications. These certifications focus on independent testing and quality assurance. I personally like a product called Herbatonin. It's 100% organic and it comes in the right dose. Caveat number 3, in some cases, melatonin might be your excuse for poor sleep hygiene. Hear me out on this. If you find yourself getting poor quality sleep because you're spending a lot of time scrolling on your phone in bed or have alcohol a bit too close to your bedtime, melatonin is not an end-all be-all solution for your sleep. While melatonin in the short term can be good for intermittent sleep issues, you might find yourself using it as a replacement for good sleep hygiene. Caveat number 4, while research has shown that melatonin doesn't include dependence on it for sleep, if taken frequently, there is something to say about a psychological dependence that might occur. Say you use melatonin every night and you run out. You may tell yourself, oh no, I'm not going to get a good night's rest without it, which can domino effect and keep you awake because your thoughts are telling you otherwise. You may also find with continued use that your regular dosage isn't affecting you like it did before, which by the way can absolutely happen. What's important is you stop the frequent use and try to rely on other sleep strategies and tips before continuing to use melatonin on a regular basis. Another thing that you really want to think about before taking melatonin is Is this interacting with any of my other medications? There's a laundry list of medications that could be interacting with melatonin. These include high blood pressure medications, diabetes medications, depression medications, what are called SSRIs, immunosuppressants, even contraceptives. So consider talking to your primary care physician before adding melatonin as a sleep aid. It's worth weighing out the pros and cons before using due to these interactions. And lastly, the honest truth is melatonin just doesn't work for some people. So what could you take instead of melatonin? One great option I tell my patients about is to consider L-theanine. L-theanine is an amino acid that is found primarily in teas and even some mushrooms. It is shown that it can help alleviate anxiety and stress, therefore giving you just that extra nudge to help you fall asleep. CBD is also a great option, yet quite polarizing due to its linked nature to cannabis. But what's important to note is CBD will not make you high, but will improve your anxiety and your stress levels, hopefully promoting sleep. I also recommend figuring out what your chronotype is. What exactly is a chronotype? In a nutshell, chronotype is your natural inclination for when your body wants you to go to bed and wake up. These generally are based on when melatonin production begins and ends for a specific individual. This can be a good indicator if maybe your sleep timing is off balance, and a simple readjustment may be just the right push for you to get better sleep quality. If you're curious about what your chronotype is, do me a favor, swing on over to my quiz, chronoquiz.com. Once you've taken the quiz, you'll be identified as one of 4 different chronotypes, each with a specific recommended bedtime. If you sleep according to your chronotypical bedtime, chances are you'll fall asleep more easily. Another tip I recommend to my patients, stick to a consistent sleep schedule. And yes, that includes the weekends. Having a routine sleep schedule will help tremendously at regulating your body's natural internal clock, or what we call your circadian rhythm. By reinforcing this, not only will it make it easier on your body to wake up naturally, it will also make it easier for you to fall asleep. A benefit to regulated sleep timing is that it can help improve the quality of your sleep. Sticking to a schedule will help to prevent fragmented sleep, which disrupts our deeper sleep stages. And with time, you'll only start to see more improvement with your sleep. All right. I hope with this video, you are able to pull something new that you didn't know about melatonin for sleep. And if you're having trouble with waking up in the middle of the night, check out this video right here. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.